referring back to the pandemic that we're facing, what has been your role in healthcare in the middle of the COVID-19 pandemic?
So the COVID-19 pandemic has been quite interesting for me. It's been such a learning opportunity, not only from the medical side, we're learning every day, but from the administrative side, from the side of how the transition from inpatient to outpatient works and everything in between. So I have been a hospitalist since I finished my residency, and I am very comfortable with that. So when the pandemic started, I thought, all right, great, I'll just go and take care of direct care of COVID-19 patients. But because of my prior experience in disaster relief efforts and global health, in educational efforts, the leadership thought that maybe I should have another role in it. And we started learning from other areas and even the hotspots within the US. That one of the things that happened with COVID-19 is that it can quickly overwhelm the healthcare system. And we needed to have a way to keep patients home. And through that, we decided to create a network for these patients, and it became a virtual clinic in which we can keep these patients home and offer the care that they need and the monitoring that they need at home, even up to, in some patients, 24 hours a day, but yet keeping them out of the hospital, not only before they get to the hospital, but they can be moved quicker out of the hospital, having these resources in place. And that's where the COVID Confirmed Clinic, or CoCo Clinic for short, uh, came to be. So I've been the medical director of the clinic, alongside the administrative director, Dr. Oxner. We love working together. We just love it. So we started creating these protocols for a virtual clinic that is going to assist the COVID confirmed patients since March, at the beginning of March, and then March 30th is when we launched the clinic. And ever since, we have been able to receive over 75,000 referrals. I'm sorry, 7,500 referrals of patients, not 75,000. That's too much, but it's a big, substantial part of the patients that have been diagnosed with COVID-19 in the hospital county. And we have been able to be successful in keeping these patients home, assisting these patients when they get out of the hospital to provide with the post-hospital care, as well as provide a lot of education to the community. And it has been such a wonderful learning experience for me. I've done a lot of things that I've never done before, including full-time outpatient care for a little bit, which of course, I provide a primary care through Global Health, but not to the extent of that being my full-time job for months at a time. So that was definitely new and different. And I think we learned a lot about the structure of our system and how multidisciplinary care is the backbone of healthcare. We can't do it without our colleagues from nursing and physical therapy and case management and pharmacy. It's just extremely important, and how the communication between inpatient and outpatient providers is just vital to appropriate patient care.
Absolutely. That my understanding is that clinic recently was awarded. What kind of award were they given?
So it was given the USF Cultural Coin Award for community service. And it is one of those things, like, you don't really think that you're doing anything different than what you do on a daily basis. We care for patients every day, and you reassure and educate patients and help them through their diseases and hold their hands on daily basis. So receiving an award for that is a little bit weird, because that's what we do. That's our job. But the reality of things is that our group has done an amazing job caring for patients. Our nurse manager, we cannot imagine done anything without her, Christine Jennings, as well as Dr. Ixiak, who has helped us from the data standpoint. and then just the day-to-day management. I don't really do numbers and all of that kind of stuff. So they have been vital to the clinic, but most importantly, our trainees. The clinic is completely run by medical students, nurse practitioner students, pharmacy students, and other volunteers. And without you guys, we wouldn't have been able to care for these patients, to see this amount of volume of the patients. So this is a good recognition, even though it feels weird to get an award for your job, just doing your job, what you're supposed to do. It is a great recognition to all of our trainees stepping up in a setting of a time of uncertainty, a time in which we were concerned about our own health, and it has been an incredible experience.
Awesome. Well, in your opinion, what, as healthcare professionals and as, global citizens, needs to be done to bring relief for the COVID pandemic and perhaps even to end it?
Well, that's a great question, and I think we don't have a straight answer for it. I think we have been in mitigation phase for a long time, and I think that's important. Minimizing the transmission of a virus is important, and I think that's going to be a big part of how we end this. We definitely are looking to continue to wear masks and social distancing as much as we can, and be really cognition of hand hygiene and things like that for a long time. With that said, though, in order to end this, it's not really a reasonable goal just because of the size of our population to achieve herd immunity. Knowing that what the numbers required to achieve herd immunity for this virus is. So I think our focus should be in two areas. One of the areas, of course, is going to be a chemoprophylaxis and or vaccine. Focusing on getting a vaccine that is going to either minimize the symptomatology of the disease or prevent it completely. And then, in the other hand, chemoprophylaxis. If you're exposed to it, what can you do to prevent this infection from affecting yourself? That should be one of our main focuses, and it has been. And the other focus should be treatment. We don't have adequate treatments. We do have some mortality benefit from dexamethasone. We have some morbidity benefit from remdesivir, but we don't have adequate treatments just yet. So I think our focus should be on a vaccine and chemoprophylaxis, and or both of them ideally, and then adequate treatments. Once we have those, I think we can relax a little bit more some of the public health measurements. But until then, we'll have to be responsible and continue with some of the mitigation efforts.
All right. Well, thank you, Dr. Perez-Colon. That was a really great overview of everything that you're involved in, and some really hard-hitting points there at the end for people who are curious about, ongoing efforts for COVID-19. So do you have any last-minute comments or...
No, I just want to say, you guys, it's absolutely, you guys are my pride and joy. And, the amount of things that, the ideas that you guys come up with, and as a mentor, it cannot be, better just to see you guys succeeding and doing all of these amazing things and working in global health and international health is just fantastic. And I am very grateful to be able to be a mentor in this scholarly concentration.
Thank you. Your time is so appreciated.
Okay. Lovely talking to you, Kat. Thank you very much.